Hi everyone, we are Group 17. Today we'll present our research on the understudied health effects of GLP-1 receptor agonist. We used a nationwide cohort study to investigate it, and here is an overview of our presentation.
GLP-1 agonists are medications for treating type 2 diabetes and obesity. They mimic the GLP-1 hormone, which helps regulate blood sugar and often results in significant weight loss. The global market for these medications is projected to exceed $100 billion by 2030.
We have two main research questions. The first one is, how do GLP-1 affect obesity, type 2 diabetes, cardiovascular disease, and brain health compared to other available medications? Secondly, if there are effects, how do they vary across populations based on age, race, sex, and baseline health conditions? We use the TruVita database, which contains electronic health record data of over 100 million patients in the United States, including their medications, diagnosis, lab test results, and more. The large-scale HR data allows us to adjust for confounders, draw reliable conclusions, and facilitate doctors' decision-making.
TruVita offers data on over 100 million patients. We extracted data for our study, which gave us a population of 5.7 million people. Almost all have at least 3 years of medical history. The population is mostly white, with a slight majority of females, and nearly all are over 30 years old, with more than half being over 65.
Noticing that our population is older, you might wonder how we chose them. So we focused on people who are eligible for GLP-1 drugs, including people with obesity or diabetes based on their BMI, fasting plasma glucose, or disease codes. Now, to compare GLP-1 drugs with other treatments, we also need to include patients who have used alternative drugs, such as orlistat, which is for weight control, or metformin, which is for blood sugar control.
In analyzing our data, we focus on two key measures, BMI and hemoglobin A1C. 75% of our male population were overweight. Also, a significant portion of our population has prediabetes, with the average A1C level exceeding 7.
Now that we have years of medical history for each of our 5.7 million people, we'll use this data to see how GLP-1 drugs impact different health outcomes. We use a method called target trial emulation. So what is target trial emulation? In clinical trials, treatments are assigned randomly to ensure unbiased results because all other factors are evenly distributed. In real life, however, doctors don't assign treatments randomly. They base their decisions on patient characteristics. To address this, we'll manually balance these characteristics across treatment groups. In this way, we are simulating a randomized trial, and what we're doing is called a target trial emulation. And here's how we do the target trial emulation. We start by setting an index date for each of the patients, and this index dating is similar to the start of treatment in a clinical trial. We'll collect patient characteristics from before this date and then balance them statistically. Finally, we'll track how patients do after they start taking the drug and gather outcomes at the end of the follow-up period.
To simulate randomized trial and ensure accuracy, we matched baseline covariates such as demographics, socioeconomic status, and comorbidities between the treated and control groups. The covariate balance plot shows that the differences between groups should be minimal after these adjustments. For outcomes, we focus on the average change in key measurements, with secondary outcomes including average changes in other measurements and complications related to type 2 diabetes and obesity over time.
For studying the effects of GLP-1 drugs on obesity, our eligibility criteria are structured as follows. We begin with individuals aged 18 or above who have either a BMI greater than or equals 25 or have ICD codes indicating obesity. Then, we exclude individuals with diabetes and those who do not have at least 1 year of data prior to their index date to ensure we have adequate baseline measurements. This process results in a study cohort that is obese but not diabetic. For studying the effects of GLP-1 drugs on type 2 diabetes, the eligibility criteria are shown here. For other analysis, the cohort is a combination of the type 2 diabetes cohort and the obesity cohort. Moving forward, we will perform causal inference to evaluate the treatment effects of GLP-1 drugs. Overlap weighting will balance the treatment control groups, ensuring that they are comparable. We will assess the heterogeneous treatment effects across different subgroups. We will also perform sensitivity analysis to assess the robustness of our findings. This is our Data Plus project. Thank you so much for listening.